The conditions are appalling. People have lost absolutely everything. So when we talk about infrastructure and health infrastructure, it's been pretty much entirely wiped out in Tacloban, and we're sure in other areas that are more remote and harder to reach. That means people are desperate because they don't know where to go. People with injuries, our first port of call, that's what we've been trying to do today, is set up sort of frontline emergency medical services to deal with the initial wave of injured, and meantime then trying to re-establish contact with what was the Tacloban public hospital, see if there's a sufficiently adequate infrastructure that we can base ourselves from to help support the medical relief effort on the ground. So, yeah, the conditions are about as bad as you can get, with access being, of course, predominantly the major challenge, major frustration for everyone, both the survivors and for, of course, relief agencies who need to find a way to ramp up the logistics and the ability to get people and supplies on the ground.
And of course, with communication being cut off, that's another issue, as well as the roadblocks. So it must make it very difficult then for your staff to reach the areas.
Yeah, it is, and I coordinated a relief effort in Haiti. It's quite reminiscent that communications were just wiped out, and we've got a team. They've gone in pretty much blind. We've got several teams on the ground. It's very hard for us to coordinate with them. To basically using satellite communication, there's nothing else available. We really have to give them the time and the space to manage the immediate pressures that they're facing, trying to undertake rapid assessments, get in contact with people, establish some coordination.
And in terms of staff, so you've mentioned you have the medical personnel there, but you're also ensuring that there are psychologists available. How important is their role in such a situation?
Yeah, it is absolutely fundamentally important in these kinds of disasters. The impact of what's taken place physically on this population, of course, we can all see the immediate physical impact, but the psychological trauma is going to be long and very, very deeply scarring on that population. And anything we can do to help them cope with the immediate impact, the mental trauma that they're going through now, will have a massive impact on how they'll be able to recover both physically and how they'll be able to just simply re-find community and be able to cope on a day-to-day basis with what's going to be a very, very, very tough and long protracted situation over the next weeks and months. So for us, it's absolutely essential. The medical care, of course, is paramount, but alongside that, we have to start trying to deal with the psychological impact, the impact on people's mental health, and therefore their ability to take care of themselves and take care of each other.
And in terms of the injuries, is the majority of it relatively minor injuries, or are there significant injuries to work on?
Yeah, look, in these kinds of disasters, particularly flooding, what we tend to see most of what we would classify as more minor injuries, and perhaps here you and I wouldn't, but broken bones, lacerations, cuts, bruises, head traumas, injuries of that nature. Now, these are things that we can deal with without complicated levels of care. So, this is largely what the types of injuries that we can deal with on the spot. Then there'll be, of course, a range of other medical problems that people will present with that they may well have been dealing with before the crisis, and there the real challenge is that, of course, there just are no medical services. So medical supplies have been washed away, medical personnel can't be accounted for, so very quickly we'll have to deal with a range of other medical issues. One of which is an absolute priority, of course, is going to be dealing with women in pregnancy and dealing with providing them a safe space for delivery.
Do you have any numbers on how many medical staff you're sending there and how many medical kits are required?
Yeah, we've really scaled up quite quickly. So we have already frontline rapid assessment teams on the ground. It's about 15 people, and it's growing right now as I speak. We have another 50 people from different countries on their way. We have 3 cargo freights airplanes on their way now with around 330 tons of medical and other relief items. So, yeah, for us, of course, it's about re-establishing primarily that we have some pharmacy, we have access to medical materials, especially what we need to deal with the more immediate injuries. And then, of course, a range of relief items, and providing medical care won't be the only service. We'll be involved in primarily shelter, ensuring people have access to clean water. And, of course, one of the biggest public health risks will be managing with waste. So we'll be involved in a range of different activities. Of course, our primary responsibility right now is to secure those medical services.